When I was a medical student, bowel cancer essentially occurred between the mid-50s and 70s. But today, 10% of the bowel cancers are occurring in people under the age of 50. Indeed, a number of those young people are not only in their 40s, but even in their late 30s. Historically, we either had a very tiny group of genetically predisposed people who might have inherited one of the polyposis syndromes, where they have hundreds or even thousands of polyps with a 100% chance of cancer at a younger age. But other than that group, they were all what we call sporadic, i.e. we didn't really know the cause. Now, because we're seeing it in the younger people, we're very concerned that although there might be some genetic changes going on in all of us all our lives, it might be because the foods we're eating today are different than we used to eat.
Regardless of age, over 30% of people develop polyps in their bowel. While not all polyps become cancerous, all bowel cancer arises from polyps.
Every single cell lining our bowel dies after about 10 days and we get a new one. If one cell says, hang on, I ain't going, and it stays there, it will divide into 2 new cells, and those 2 later divide into 4, 8, 16, 32. Hence the polyp is a mushroom growth, as it is growing exponentially, not cell by cell, and all of those generations of cells as they grow are becoming abnormal, and we produce what becomes a cancer. And eventually those cells are so abnormal, they separate, penetrate the wall of the bowel by growing through the wall, then get into the lymphatic tissue and the vessels, get into the bloodstream, and then we might be in trouble down the track, if not already.
For those diagnosed with bowel cancer, there's now renewed hope in the search for secondary sites.
There is a blood test recently identified which has shown the DNA from the circulating cancer cell in the blood. So you can say that that patient has a very high risk of implantation of those cells, in which case, yeah, give them chemotherapy, because although we've cured them locally, there's a high likelihood of potential implantation of the circulating DNA from that cancer. But with the new blood test that's available, we might be able to eliminate those that have a negative blood test and not follow them up for recurrence of their cancer.
As bowel cancer is preventable, it's crucial to be aware of it at any age.
Get yourself checked if you've got some blood, and don't ignore it thinking to yourself or even your GP saying it's probably only hemorrhoids. Be checked and be safe.